Good morning, the organizers of this conference. It's a great pleasure to be part of the participants of this conference. And the format of my presentation is the format that was given to me by the conference organizer. So which starts with the summary, because I couldn't see other presenter following that particular summary. So I hope I'm on the right track, isn't it? So based on the summary, the immunization remains one of the most important public health interventions and is very, very cost-effective strategy to reduce the morbidity and mortality associated with infectious diseases. Studies have shown that over 2 million deaths are delayed through immunization each year worldwide. That is to underscore the importance of immunization. But despite this, vaccine preventable diseases still remain the most common cause of childhood mortality, with an estimated 3 million deaths each year, and the reference there. The uptake of vaccination services is dependent not only on provision of these services, but as well on other factors, including the knowledge and attitude of the mothers. The parental satisfaction is the most important element when dealing with pediatric care, because their role is pivotal and it is considered an indicator of provider quality that has been relatively unexplored in relation to childhood immunization. So what we are saying here is that over the years, people have been assessing the immunization services, especially the quality, but that quality cannot be properly assessed until when we have been able to assess the parental satisfaction. That is how the parents that are bringing these children for immunization, how they are satisfied with the quality of care that is being given through the immunization services. So, moreover, satisfaction has been said to be a major predictor of use of services because it is essential if clients were to utilize services. In other words, what are we saying? If you want a parent or a client to utilize any service, it has to be satisfied with that particular service. If it's not satisfied, definitely it will not come for that particular service. And one study reported that there's an association between parental satisfaction with pediatric care and uptake of immunizations at 24 months, independent of maternal age, race, and education. So in other words, some factors, for example, maternal age, race, and education, are not associated with, satisfaction. Once the service is good, the parents will be able to bring their clients, bring their children, for that particular service. And the study has even, corroborated that. Then assessing the outcomes as merit, both as an indicator of the effectiveness of different interventions and as part of monitoring system directed to improving quality of care, as well as detecting its deterioration. So a study reported an association between parental satisfaction with pediatric care and up-to-date immunization at 24 months. In other words, because of the parental satisfaction, it has also been reported that immunizations have even been up to date, especially among children less than 24 months. And again, research on parental health beliefs and attitudes often assume that parents decline immunization, more especially when they have a belief that that particular service is not good. Definitely, is going to reduce their patronage of that particular service. So assessing outcome has merit both as an indicator of effectiveness of different interventions. So what? In other words, what are the problems? For parental satisfaction, parents were asked to assess not their own health status after receiving care, but satisfaction with the service that has been given. And some studies have found that customer satisfaction with health care services in Africa was one of the most important factors that determined the utilization of the services. Determinants of perceptions of quality of service, for example, in India, also include perceived time spent at the facility, availability of immunization, availability of child health services, and the staff strength of the health facility. That is, when there is a perception about the quality of the service, it actually affects, the satisfaction. So what are the methods that were used in conducting this study? This is a cross-sectional study, and it was conducted among 455 mothers that were attending the primary care centers for vaccination of children less than 1 year. The study was conducted between March to August 2008. The required sample size was determined using proportional sampling technique. So what do I mean by this? The studies were conducted in primary health care centers, and we have to use proportional sampling technique because the client volume in each of these particular primary care centers differ. Since they are not equal, definitely we must use proportional sampling technique. So then the maternal knowledge was assessed by a knowledge score questionnaire, and the maternal satisfaction with vaccination was also evaluated using Likert scale score. Data were analyzed using SPSS version 13, and the level of statistical significance was at p-value less than 0.05 and at confidence interval of 95%. The analysis was to assess the knowledge score, the satisfaction level, as well as the relationship between the satisfaction and knowledge using the chi-square test. So we also went further to use binary logistic regression to examine the relation between the outcome variable and the predictors. And the results are also presented using odds ratios and confidence intervals. Informed written consent was obtained from all the participants for their participation after the nature of the study was fully explained to them in the local languages. All the information obtained from the participants were kept confidential, and identification of each participant was by numerical codes. So we didn't identify the participants by name, but we gave code to them in order to maintain the confidentiality. And in addition, the participants, also has the right to withdraw at any time of the study. So nobody was coerced, into the study, and nobody was given incentives so that you can participate in the study. So we explained the nature of the study to them. So what are the results and the discussions? All the participants, that is 455, responded, thus giving us a response rate of 100%. We had greater than 1/10 were aged less than 18 years, while the majority of the respondents, that is 64.3%, were between 23 to 27 years. Majority, that is 88.2%, had no formal education, and only 11.8% had between primary and secondary education. About 3/4 of respondents were married, while only 5.2% were widowed. The study showed that 60.4% of mothers evaluated childhood immunization services as good, compared to 36.2% of mothers who evaluated it as being fair, while 3.4% evaluated it as inappropriate or poor. So we tried to also test some hypotheses, and these are the hypotheses we tried to test. One, there's a statistical significance association between education level and parental satisfaction with immunization service. Then the second one was there's a statistical significance association between healthcare providers' attitude and parental satisfaction in immunization services. So education didn't show any significant association with the maternal satisfaction with immunization services. Yeah, so it doesn't show any satisfaction. Even those people that are not educated, they were able to say that they were satisfied. So, and we are also able to record that even among those people that are even educated, there was no difference between the educated and non-educated. So education has no significant association with the maternal satisfaction in this study. The study also revealed that more than half, which is 58.5%, were satisfied with childhood immunization services delivered. And maternal satisfaction about staff attitude was 56.1%. And concerning the waiting place, that is where they received the vaccination, it was assessed to be 50.8%. Then concerning the waiting time before they receive vaccination for their children, it was 32.4%. Most of them complained that they have to wait a lot. Then concerning the information given, it was 48.5%, and about cost, it was 49.7%. So majority of the respondents still said the health providers allowed them to express themselves easily, and they were pleased with the attitude of the healthcare workers. So that's what the majority of them said. This result is similar to a previous study which also revealed that uneducated mothers were more satisfied with maternal and child care services they received in rural Bengal when compared with their educated counterparts. This means that the communication between the patients and providers plays a major role in determining the satisfaction of the patients. In addition, this study also revealed that there was a statistical significant association between perceived services relating to facilities and client satisfaction. So what I mean by this is that when a client has a perception about service being offered by any facilities, it has a way of influencing their satisfaction level. For example, women, which is 76.5%, who perceive the hospital services to be good in this study, were very satisfied with the services they received because they've already had a perception, and this one, invariably affected their level of satisfaction. Similarly, there was also a statistically significant association between healthcare providers' attitude and overall client satisfactions. In a situation whereby the attitude of the healthcare or immunization service providers has been judged to be good, this one directly also affects the client satisfaction. A high proportion, which is about 56.1% of patients who perceive attitude of the healthcare provider as being very good, was very satisfied with the immunization services received at the health facility. This is what the study, brought out. Then, when the knowledge findings in these studies was also compared, because we try as much as possible to also compare, our own findings with that of similar studies. When we compare the findings in this study with that from study from Egypt and another study in Nigeria, India, and Timor, our figure is still low probably because of the difference in educational background, the study area, information delivery, method of vaccination, and staff access. Because our own study was done in a rural area, and some of these studies, I think they were done in an urban area, and some of their clients, they are more educated than our own. So the significance of this research and what should be done next include: one, this study showed that 60.4% of mothers evaluated childhood immunization services as good, compared to 36.2% of mothers who evaluated it as fair, while 3.4% evaluated it as inappropriate or poor. But the overall satisfaction rate was 48.8%, which is still lower compared with other studies. Attitude of immunization service provider is a significant determinant of client satisfaction with immunization services. There is an association between perceived immunization services relating to facility and satisfaction level. Further study will be conducted to explore: one, staff attitude and acceptability of immunization service uptake; two, determinants of childhood immunization uptake among socio-economically disadvantaged mothers in rural areas. So this is what we also hope to do in the future. So these are the references. Unfortunately, based on the guideline given to us to do this presentation, the references come before conclusion, and I don't have any option than to follow the guideline very, very strictly. So these are the references, and we are being told in the guideline that we should try to limit our references to 5. So these are the references, and these are my conclusions. Maternal satisfaction about vaccination is sine qua non for the completeness of immunization schedules, but it doesn't depend mainly on maternal knowledge about vaccination, but other factors such as attitude, waiting time, and cost. So in other words, what are we saying here? There are other factors that still affect, maternal satisfaction, not necessarily, on the knowledge. Even though the maternal satisfaction is fair in this study, there is still a need for improvement, especially in information giving process and positive attitude of immunization service providers. Because if you look at our overall satisfaction compared with other studies, it's still very low. And we believe that, okay, we still have to do something, probably on information giving process, maybe the clients, these immunization service providers, they are not giving them enough information so that they can have it properly digested and properly understood, so that that one can influence their satisfaction. And again, the attitude of the immunization service provider still have to be worked upon, because you can see that the waiting time is still about almost more than one third still complain that the waiting time is long, and which is an area which also influence either directly or indirectly the client satisfaction. Because once the client goes to the clinic and he spends so much of the valuable time that is supposed to have been used in doing other valuable things, at the end of the day, it may affect his satisfaction when being asked to judge it. Then when the knowledge score in this study is compared to other studies, it is still low. So therefore, the EPI coordinators need to do more advocacy work that includes better reception, coherent information, and proper work ethics during the service delivery, because the knowledge score in this study is low. So we now advise and encourage the EPI coordinators in those health facilities to do more advocacy work, which will include better reception. I think the client needs to be better received.
Thank you so much, Ibraheem Abdulraheem, for the wonderful presentation. And we go next to the polling session. So, dear participants, please poll for Mr. Ibraheem Abdulraheem on the presentation of parental satisfaction and barriers affecting immunization service in Nigeria rural communities, a user satisfaction survey. Here the results are broadcasted now, and we are ending the polling session also.